Hello everyone, my name is Dr-Aftab Hussain and today we will discuss biopsy and its types. So, what is biopsy? Biopsy is derived from a Greek word biopsy. Bio means bio meaning life and opsy to look vision. We will discuss when we will take the biopsy, why we take the biopsy and where we take the biopsy. Indication we will discuss indications where is when is oral biopsy not needed, objective suspicious of malignancy, contraindications, all we will discuss about uh, in this PPT. So first of all we will discuss with start with definition. Biopsy is a surgical procedure to obtain tissue from a living organism for its microscopical examination, usually to perform a diagnosis. So a biopsy हम क्यों लेते हैं? Why we will take the biopsy for the diagnosis purpose. ठीक है. Characteristic of lesions that arise the suspicion of malignancy. Specific red and white lesion. Ulceration. Lesion is ulcerated or presents as an ulcer. Duration. Lesion has persisted for more than 2 weeks. Growth rate. Lesion exhibits rapid growth. Bleeding. Lesions bleeds on gentle manipulation. In duration. Lesion and surrounding tissue is firm to the touch. Fixation. Lesion feels attached to adjacent structures. So that's indication for the biopsy. Persistent hyperkeratosis, changes in surface tissues. Example, lips or oral mucosa. Lesion that interfere with local function. Example, fibroma. उसके बाद है any inflammatory lesion that does not respond to local treatment after 10 to 14 days, that is after removing local irritant. So that's the indication for biopsy. And other bone lesions not specifically identified by clinical and radiographic findings. Any lesion persists for more than 2 weeks with no apparent etiology basis. Any lesion that has the characteristic of malignancy. So here is when is oral biopsy not needed. नॉर्मल स्ट्रक्चर्स में नहीं लेते. इन्फ्लेमेटरी और इन्फेक्शस लीजन्स दैट रेस्पॉन्ड टू स्पेसिफिक लोकल ट्रीटमेंट्स उसमें हम नहीं लेते बायोप्सी एज पेरी कोरोनाइटिस, जिंजिवाइटिस और पेरी ओडेंटल एब्सेस, एंजियोमेटस लीजन्स. We don't take oral biopsy in that cases. Contraindications हैं एंटीकोगुलेंट थेरेपी. एंटीकोगुलेंट थेरेपी में हम नहीं लेते बायोप्सी. ओवरवेलमिंग सेप्सिस में भी नहीं लेते. और सीवियर इम्पेयर्ड लंग फंक्शन, अनकंट्रोल्ड ब्लीडिंग, अनकोऑपरेटिव पेशेंट, लोकल इन्फेक्शन नियर द साइट. These are the contraindications of the biopsy. Objectives of the biopsy: to confirm a diagnosis made on clinical findings, to determine the treatment plan as a medical record. Classification of biopsy: features of the lesion, direct biopsy and indirect biopsy. When the lesion is located on the oral mucosa and can be easily assessed with a scalpel from the mucosal surface. Indirect biopsy when the lesion is covered by an apparently normal oral mucosa. By the timing of the biopsy: clinical timing of sampling, preoperative, intraoperative and postoperative. Purposes of the biopsy: diagnostic, experimental biopsy. ये दो पर्पज़ होते हैं बायोप्सी के, डायग्नोस्टिक और एक्सपेरिमेंटल बायोप्सी. टाइप्स ऑफ बायोप्सी: सर्जिकल बायोप्सी इंसिशनल होती है, एक्सिशनल एंड पंच बायोप्सी. उसके बाद सेकंड है फाइन नीडल एस्पिरेशन साइटोलॉजी, FNAC एंड CT गाइडेड FNAC. उसके बाद है नंबर 3 पे एक्सफोलिएटिव साइटोलॉजी, नंबर 4 पे है ब्रश बायोप्सी, नंबर 5 पे है फ्रोजन सेक्शन बायोप्सी, नंबर 6 पे है कोन बायोप्सी, और उसके बाद है कोर नीडल बायोप्सी, सक्शन असिस्टेड कोर नीडल बायोप्सी, उसके बाद है लेज़र बायोप्सी. So all we will discuss about all these types. Steps of biopsy, selection of area of biopsy. सबसे पहले हम सिलेक्ट करेंगे एरिया ऑफ द बायोप्सी. उसके बाद प्रिपरेशन ऑफ सर्जिकल फील्ड, लोकल एनेस्थीसिया, इंसिशन, हैंडलिंग ऑफ स्पेसिमेन, देन लास्ट में सुचरिंग ऑफ द रिजल्टिंग वुंड. सबसे पहले इंसिशनल बायोप्सी. This is the picture of the incisional biopsy is taken from this. Incisional biopsy indications हैं, size limitations हैं, hazardous location of the lesion है, great suspicion of malignancy. Technique: representative areas are biopsified in wedge fashion. Margins should extend into normal tissues. On the deep surface, necrotic tissue should be avoided. A narrow deep specimen is better than a broad shallow one. This is a figure incisional biopsy. First we field a block with anesthesia and then cut with a scalpel with the normals and close normal skin. This one is incisional biopsy. If a lesion is large or has different characteristics in various locations, more than one area may need to be sampled. Disadvantages हैं crush, splits and hemorrhage are the artifacts most frequently found in incisional oral biopsies. Theoretical seeding of cancer cells into adjoining tissues. उसके बाद है excisional biopsy. This is a figure also. Excisional biopsy implies the complete removal of lesion. Indication should be employed with small lesions less than 1 centimeter. The lesion on clinical exam appears benign when complete excision with a margin of normal tissue is possible without mutilation. Excisional biopsy technique: the entire lesion with 2 to 3 mm of normal appearing tissue surrounding the lesion is excised if benign. For mucosal lesions, careful excisional biopsy. This is a figure. उसके बाद आती है पंच बायोप्सी. ठीक है. Technique of a punch biopsy range in size from 2 to 10 millimeter in diameter. The smaller diameter should be avoided due to the risk of over manipulating and crushing the tissue. The technique is easily performed with a low incidence of post-surgical morbidity. Suturing in regards to a punch biopsy procedure is usually not required as the surgical wounds heal by secondary intention. This is a figure of punch biopsy A and B and C. The last one cutting tissue is used in there for the punch biopsy. This is a figure for the punch biopsy. Advantages: ease of technique. Sutures may not be required if small diameter punch may produce a more satisfactory specimen in bone down tissue, example hard plate. Drawbacks: may not be adequate for biopsy of deeper pathology, may be difficult to biopsy freely movable tissues, example soft plate, floor of mouth. Core biopsy. Needle biopsy has been established as a safe procedure and is routinely performed under local anesthesia. Many pathologists believe that for histologic study, core tissue is more useful than cytological material. This is a figure. Core needle biopsy has emerged is an important sampling method in the diagnosis of musculoskeletal tumors. Oral cytology typically used as an adjunct to not a substitute for incisional or excisional biopsy procedure. Cytology allows examination of individual cells but cannot provide the histologic features crucial for an accurate and definitive diagnosis. Developed as a diagnostic screening procedure to monitor large tissue areas for dysplastic changes, lesions that lend themselves to cytologic examination may include post-radiation changes, herpes, fungal infections, and pemphigus. उसके बाद है procedure of cytological biopsy. In the cytological examination, the lesion is scarred repeatedly and firmly with a moistened tongue depressor or cytology brush. The cells are then transferred to and smeared evenly on a glass slide. The slide is immediately immersed in a fixing solution or sprayed with a fixative such as hairspray. The cells can be stained with any of a myriad of laboratory preparations and examined under the microscope. The advantages and disadvantages of oral cytological procedure include advantages. Number first, we will discuss advantages. Cytology may be helpful when large areas of mucosal change are noted, or an area with difficult surgical access. Disadvantage: not every reliable with many false positives expertise in cytology is not widely available. उसके बाद है brush biopsy. Diagnosis of oral epithelial dysplasia has traditionally been based upon histopathological evaluation of a full thickness biopsy specimen from lesional tissue. It has recently been proposed that cytological examination of brush biopsy samples is a non-invasive method of determining the presence of cellular atypia and hence the likelihood of oral epithelial dysplasia.